Hi all, and welcome to our lecture today on the physics of sound and ultrasound. After this lecture, you should be able to appreciate ultrasound's position in the medical imaging field, define sound and ultrasound, use the human voice and hearing as an analogy to explain ultrasound, and finally, you should be able to discuss key physics of sound and ultrasound. When you hear the word ultrasound, what comes to mind? For many people, an image like this comes to mind, fetal ultrasound imaging. But there are many other applications of ultrasound, such as tumor detection. Ultrasound is used to guide biopsies and surgeries. It's used for treatment evaluation of vascular disease with Doppler applications. Additionally, there are therapeutic applications of ultrasound. Focused ultrasound is used to ablate tissues and to enhance drug delivery. Also, there's lithotripsy and vascular thrombosis, or ultrasound diathermy, or other applications, therapeutic applications of ultrasound. Ultimately, there are a lot of different applications. So why would we ever choose ultrasound when we have MRI or X-ray or CT? Well, this slide will go through some of the advantages and disadvantages of each of these modalities. Ultrasound, first of all, is safe. That's one of the biggest advantages. It's also less expensive than other imaging modalities. It can be done in real time, so a doctor can give you immediate feedback on what they're seeing when they're seeing it. Many ultrasound devices are portable, and you can get good soft tissue contrast with ultrasound imaging. Some of its disadvantages are that it has comparatively poor resolution. Also, ultrasound has a difficult time penetrating bone and air, which makes brain imaging almost impossible. Makes it difficult when you're trying to image the heart with the ribs in the way. Also, it's difficult to image in the lungs or in the bowel where you have air pockets. If we move on to MRI, MRI has excellent resolution and especially good soft tissue contrast. Some of the other things it can do that others don't do as well as functional MRI, and it has an inherently 3D nature. The imaging plane can be oriented any which way. Some of the disadvantages of MRI is that it's expensive. It's also not as available as others. And the magnetic bore has challenges. If a patient has metallic implants or pacemakers, they may not be able to have an MRI. Overweight patients may not fit into the MRI bore. And patients who are claustrophobic may just not like MRIs much at all. X-ray has, again, excellent resolution, and it's particularly good for bone imaging. Its disadvantages are that it's hazardous. It introduces radiation to the patient. Also, you need a contrast agent in order to effectively differentiate soft tissues using CT. So which of these modalities is best? Well, you can't say that any one is better than the other. They have different applications and different uses. So at different times, we would choose to use ultrasound, and at different situations, MRI or X-ray or CT. Here's another way of looking at why we should care about ultrasound. This graph is the global medical imaging market share for the year 2014. As you can see, in 2014 we spent about $28 billion on medical imaging devices, which is a lot of money. That's expected to grow in the next 8 years to about $45 billion. There's two main points with respect to ultrasound that we'd like to make here. First of all, ultrasound has a large portion of the market share. When you consider that ultrasound devices cost less than others, this means there are a lot more ultrasound devices out there. Additionally, of all these fields, ultrasound is expected to grow most rapidly in the future based on high adoption rates worldwide. Okay, This is the definition of sound from the dictionary. Sound is mechanical energy transmitted by pressure waves in a material medium. If we break that down further, mechanical energy is the energy associated with position and movement of an object. It's the kinetic plus the potential energy. With sound, we're talking about particles, particle movement, and specifically back and forth vibrations. Now, these vibrations that occur in the medium are transmitted as pressure waves. Pressure waves are compressional waves. It's pressure from the particles pushing on one another. And with this spring example, you can see that when this piston pushes on the spring, it initially compresses. When the piston is retracted, that compression wave continues to move on down the line, as does this area of rarefaction, where the string has been stretched apart. Now with sound, we don't have a spring moving back and forth, but the particles in your propagation medium, which for sound is often air, for ultrasound is often the body. Finally, sound requires a material medium, which makes sense. If there are no particles to vibrate, there can't be any sound. So there is no sound in a vacuum. One easy way to remember this, here's a catchphrase from the movie Alien from the 1970s. In space, no one can hear you scream. And that's absolutely true. We're going to use this diagram to go over sound, its fundamental properties, and how they apply to ultrasound. In the top row, we'll have audible sound, our voice and hearing, and in the bottom row, the analogous ultrasound application. So the power source for our audible sound is our diaphragm and our lungs. As they compress and push air out of our trachea, they cause our vocal folds, or sometimes called vocal cords, they cause them to vibrate and generate a pressure wave in the air. This is a YouTube video we're going to watch a short clip from, in which waiting for the video. Okay. This is a laryngoscopy in which they've taken a scope down someone's throat to look at the vocal folds while they're moving. When you're breathing, it's nice and open so air can get through. But when you start to speak, these vocal folds stretch out, come together, and vibrate. So this is the front of the person's throat and the back. Let's skip forward. You'll notice as the vocal folds stretch longer, you hear a higher pitch. And as they're shorter and floppier, we get a lower pitch. So the length, thickness, and tension of the vocal folds will affect the frequency. Now here's some different fun facts for you about frequency and the human voice. But the most important thing here is that the audible range of frequencies that humans can hear is from about 20 hertz to 20,000 hertz. When we look at ultrasound, what is the power source? Well, instead of the lungs, we just have electricity. And the transmitter isn't our vocal folds, but it's an ultrasound transducer. Next, we're going to talk a little bit about how ultrasound is, how we convert the electrical energy from our wall outlet into the mechanical pressure wave, and how the ultrasound transducer does that. It starts by talking about the piezoelectric effect. French physicists Jacques and Pierre Curie discovered the piezoelectric effect in 1880. Quartz was the material that they discovered it in. Now, what this effect is that if you apply a material stress, if you push on certain materials like quartz, you can measure a voltage difference across their faces. It has a lot to do with the crystalline structure of these materials. A year later, Gabriel Lippmann mathematically deduced the inverse effect from thermodynamic principles, which was confirmed immediately by the Curie brothers. Now, for 30 years, this piezoelectric effect was nothing more than a lab curiosity. It was pretty neat. But in World War I, Paul Langevin came up with the first practical application of the piezoelectric effect, sonar, which was developed for detecting submarines in the war. They used thin quartz crystals for their ultrasound transducers. Now, after World War II, the US, the Japanese, and the Russians all developed and manufactured new materials that would help replace natural crystals. They developed piezoceramics, PZT, PVDF, or barium titanate. And these are special materials that allowed a greater amplification of, less stress for more displacement, essentially, of the materials. Today, piezoceramics are used in a lot of different applications: microphones, printers, and, of course, ultrasound. How they work with ultrasound devices is in transmit mode, we use the reverse piezoelectric effect. We apply a voltage across the faces of the ultrasound transducer, and the stress in the material is manifested as a displacement, as is shown with this graphic. When the ultrasound is in receive mode, we use the piezoelectric effect. So the returning pressure waves place stress on the transducer, causing a small displacement, which is then converted into an electrical signal. The frequency of ultrasound is different than that of audible frequency, and the frequency is ultimately what defines ultrasound. Our audible frequency range, as we discussed earlier, is from 20 Hz to 20 kHz. Now, any frequency higher than 20 kHz is by definition ultrasound. In these very low frequencies, we have some things like earthquakes. Some animals speak at in the infrasound range. We have our audible range. Some of the applications in this lower range, between 20 kilohertz and 1 megahertz, are ultrasound diathermy, which is used in sports medicine and in drug delivery applications. Most medical imaging is performed between 1 megahertz and 20 megahertz. And once you get above that, it becomes a lot more difficult to get the penetration you need. But there are some applications, such as acoustic microscopy, that use extremely high frequencies. The next important part of what's going on is that we need a propagation medium. For audible sound, it's typically air, and the pressure waves propagate through the air. When we're looking at ultrasound, the sound waves are propagating through the human body. Pretty straightforward. Let's talk about some of the characteristics of that. First of all, wavelength. The wavelength is essentially how far apart those compression sections of your signal are. If you've got compression here, rarefaction, and compression, how wide is your wave? That's your wavelength. And it's related through this equation to the frequency, F in hertz, and the speed of sound, C. The speed of sound is measured in your tissue. Now, why should we care about wavelength? Ultimately, the resolution with which we can image is dependent upon the wavelength of the ultrasound. In order to get better resolution, we want a short wavelength, which also translates to a high frequency. Another fundamental property of sound is the speed of sound. Now, for general waves, the speed of sound is simply defined as the displacement over the time. When we go to plain acoustic waves, the speed of sound c is defined in relation to B, which is the bulk modulus of the tissue, essentially how stiff it is, its resistance to compression, and rho, the density of the tissue. So, this is an application that I've always found interesting. When I was a little kid, one of my favorite memories is going out on the porch with my dad and watching lightning and thunderstorms. And I remember we would watch the lightning strike, and then we'd count the number of seconds until the thunder, till we heard the thunder. And we would use that to say, oh, that's how far away the lightning is. And my question is, how far apart, how many seconds per mile for that delay? What do you think? Well, a mile is just over 1,600 meters. So taking 1,600 and dividing by the speed of sound, 340 meters per second, we get just about 5 seconds per mile. So when you see the lightning, wait 5 seconds, and then the thunder hits, that's about 1 mile away. Pretty neat. For ultrasound applications, my next question is this. How about water? What should the speed of sound be in water? If we look at our definition over here, well, the bulk modulus, how stiff is the tissue? We would expect that water is a lot stiffer than air is. It's much more difficult to compress. So with that respect, we'd expect B to go up, and that would increase the speed of sound. However, the density, rho, the density of water is also much larger than the density of air. So if density gets bigger, then the speed of sound, c, should get smaller. So which effect is bigger? Well, it turns out that the bulk modulus is about 4 orders of magnitude larger for water than it is for air, while the density is only 3 orders of magnitude. This puts our speed of sound in water at about 1,500 meters per second. Well, why should we care about the speed of sound of water? Well, for ultrasound, we're using human tissue, which is primarily composed of water. And in general, this is the approximation that's made for human tissue, that the speed of sound is 1,540 meters per second. All right, so now we've got our sound propagating through air. And what's going to happen next? Well, that sound gets to our ear. As the sound waves enter our ear, they hit the tympanic membrane, and the air pressure wave is converted into a fluid pressure wave. The ossicles in our ear amplify that pressure wave by up to 22 times. As that fluid pressure propagates into the cochlea, this spiral-shaped part of the ear, it resonates with different hairs, and those excited hairs then stimulate an electrical nerve signal which propagates to the brain. Those signals are then processed and interpreted by the brain as sound, and we hear a voice. Well, how does this work for ultrasound? As the ultrasound propagates through the body, it bounces off of different interfaces and returns Here's another interesting video, an animated video on hearing, if you'd like to watch it. But we're going to move on. Well, it bounces off of those interfaces and comes back to the transducer. We can use the same transducer for transmitting as we do for receiving, which is pretty fancy. That image, or those pressure waves, are then converted through the piezoelectric effect into an electrical signal, which can be amplified, modulated, and otherwise altered and reconstructed to create our final ultrasound image. Inside this gray box, we're going to fill out some of the characteristics of sound that will also play an important role in ultrasound. So I'm going to ask some questions, and you ought to think of a single word or phrase that you would use to characterize what is going on. So as our first example, my question is, what makes a sound loud or soft? What word would you use to describe that? Well, the word we're going to use is intensity or amplitude. And so sound has intensity. Ultrasound also has intensity. And here's the equation that we use to define that. Intensity equals the pressure of our ultrasound wave squared divided by Z. Z is the characteristic acoustic impedance of the material. And we'll talk about that in a few more slides. But quick question for you. We talked about how ultrasound has a lot of noise in it. If I'm in a room with a bunch of people and they're all talking and I want to get their attention, how do I increase my signal to their noise? Well, essentially, I raise my voice. I yell louder so then I can get their attention. So my question is this: why don't we just crank up the ultrasound intensity in order to get better SNR for our imaging? Well, there's two reasons. First is cavitation. When our ultrasound is propagating through the tissue, a certain position of tissue will go through cycles of compression and rarefaction. If there are small air bubbles in that path, that will cause these bubbles to grow during times of rarefaction and shrink in times of compression. Well, as these bubbles grow and oscillate, they can reach an unstable size to the point where the bubble will collapse in on itself. This is called cavitation. Now, that imploding bubble will lead to extremely high temperatures, pressures, and velocities, which you can imagine in your body is not the best thing. Here's an example of what cavitation can do to a propeller blade. You can see here on the edges of the propeller that cavitation has caused severe pitting of the metallic blade. And this is certainly something that I wouldn't want to have happening inside my body. A second reason why we don't just crank up the intensity to get better imaging is that the ultrasound is absorbed, at least in part, by our tissue, which will cause heating. And we don't want to heat up and burn tissue unintentionally. All right, my next question. Why can you hear me whisper when I'm right next to you, but not when I'm across the room? Have you ever gone outside when it's snowing and it seems to be especially calm? Why is it so quiet? Now, what word would help to describe the effect of what's happening here? The word we're going to use is attenuation. You can't hear me whisper when I'm across the room because the sound has been attenuated as it passed across the room. Now, attenuation, when we break it down, comes into absorption and scattering. Absorption occurs as the mechanical energy from the vibrations are absorbed and converted into thermal energy. This is what we talked about causing the tissue to heat up. Another effect of attenuation is scattering. Objects that are smaller than a wavelength will scatter the ultrasound in all directions when they interact with one another. The ultrasound signal will decay exponentially as the depth of penetration increases. Here we've got our intensity as a function, well, this should be z, as a function of our depth, equals the initial intensity with this exponentially decaying term. Now alpha here is the attenuation coefficient of the tissue. Attenuation is also related to ultrasound frequency. In this equation, we have the attenuation equals the attenuation at 1 megahertz multiplied by this factor, the frequency raised to the nth power. Now for most soft tissues, n equals 1, so the attenuation is nearly a linear function of the ultrasound frequency. Now for a practice problem. How much of the ultrasound beam would be attenuated after 10 centimeters of penetration? In first water, and then to calculate it in muscle. And at a frequency of 1 megahertz versus a frequency of 15 megahertz. If you'd like, you can pause the video now and pull out your calculator and your paper and run some calculations. If not, I'll give you the answer here in a couple seconds. Okay, welcome back. Here are the values that I got when I calculated these amounts of attenuation. As you can see, at 1 megahertz in water, very little of the ultrasound beam has been attenuated. When you increase the frequency to 15 megahertz, still only 5% of the original intensity has been attenuated. In muscle, we get quite a different story. At 1 megahertz, after 10 centimeters, only 5% of the original intensity is still available. And if you go to 15 megahertz, essentially none of the original ultrasound intensity is left propagating into the tissue. So why does this matter? Well, the key points are that, first of all, water does not attenuate ultrasound very much. Next, as the frequency increases, the amount of attenuation also increases. This places practical limits on the frequencies that we can use for ultrasound imaging. And finally, in real tissues, the intensity is much, much smaller when we are going to be receiving the tissue, or we're receiving the pressure waves after it's propagated through the tissue, than when we initially transmitted it. All right, on to our next question. Why doesn't it sound as loud if I yell at you through a wall? Also, if I'm standing on the edge of a swimming pool, why can you not hear me very well if you're underwater? Last question, what creates an echo in a cave? The fundamental word that I come up with for describing these things is impedance. At least for ultrasound, that's what we use. Impedance has to deal with reflections and refraction, and we're going to break that down even a little bit more. Now, impedance is essentially how difficult it is for sound to penetrate into a material. The acoustic impedance of a material is defined by its density, rho, multiplied by the speed of sound in the tissue, c. In this table we have several values of impedances. You can see that air has a very low impedance. bone has a higher impedance, and most of our human tissues fall in this nice range, pretty close together. As far as ultrasound is concerned, it's not the value of the impedance that's so important, but it's the impedance mismatch between two materials and an interface. Here's how we'll talk about that. Reflection. We have the ultrasound coming up to a tissue interface where tissue 1 has an impedance of Z1 and tissue 2 has an impedance of Z2. When the ultrasound beam hits that interface, part of the ultrasound will be reflected back into the tissue, and part of it will be transmitted through into the second tissue. R, this reflection coefficient, is defined by essentially the mismatch in the impedance values. And how much of the intensity is transmitted is directly related to that coefficient R. So you can see based on these equations that 100% of the ultrasound will either be reflected or transmitted based on these equations. Now this is the special case of normal incidence. What happens when the ultrasound beam hits an interface that isn't perpendicular to it? Well, here's where we get refraction. Refraction is essentially the bending of a beam as it's transmitted from one tissue to the other, and it's characterized by Snell's law, which is shown here. The implication for, well, here, this is something you're probably familiar with. Refraction of light occurs when we're trying to look at a fish in the water. Because the speed of sound is different, or the speed of light is different in the water than it is in the air above it, we perceive the fish's position as being here when it is actually right here. The light has been bent, and so our perception of where it is incorrect. The implication for ultrasound is that we could potentially misplace an object. It can cause duplication of an object, widening, or even edge artifacts. Here's an example of edge artifacts. The ultrasound transducer is placed up here. You can see the carotid artery here and the internal jugular vein here. Now this shadowing that you see off of the edges of the carotid artery is essentially an edge artifact. Because the ultrasound hits these interfaces right here that are not perpendicular, the ultrasound wave is being bounced off in other directions. So there's less sound here to get reflected back from this part of the tissue than in other regions. All right, well, there you have it. This is our finished diagram of our analogy between audible sound and ultrasound. Now you may have noticed we didn't spend very much time talking about how we go from receiving ultrasound reflections and converting them into an image. Now that will be the focus of our next lecture. Hope you tune in, and thank you very much.